ended last time talking about the different vessels, and it's just sort of a refresher. You know, the two biggies, arteries and veins, and if you can sort of put this picture in your head somehow, it gives you a lot of the characteristics. So arteries are round, veins are not, right? Veins usually have strange shapes because they can't hold them, they don't hold their own shape. They're shaped by whatever it is around them. So we have that. The walls of veins are much thinner. Arterial walls are much thicker. The difference there is smooth muscle. The arteries have a lot of smooth muscle because they change their size quite a bit. The veins have just a little smooth muscle, and it's because they use their smooth muscle for something different, which we're going to talk more about later on today. And then we looked at the endothelium. The endothelium of the artery is wrinkled, usually, and of the vein, it's flat. So this is a worthwhile table to sort of look at. Okay. And then we talked about the 5 different kinds of vessels. Now I realize that there's 7 on this slide. So arteries, arterioles, capillaries, venules, veins. Those are the 5 vessels. We split the largest arteries and largest veins from the medium-sized ones because they have some different characteristics. So like the largest arteries of the body are called elastic arteries, and that's because their walls are very springy. And what we'll see when we look at the heart and how it creates blood pressure is because these pipes are springy, it actually helps to keep blood pressure present even while the heart isn't contracting. So even while the heart is relaxing, because the walls of these large arteries are springy, they're springing back all the time that the heart is relaxing. But more on that later. All right. The muscular arteries, they're not named because they go to muscles. They're named because they have lots of smooth muscle in their walls. So these are the medium-sized arteries. Most of the arteries that you will have to know the names of, which we'll get to at the end of today, are this kind of artery, are muscular arteries. So like the renal artery, the radial artery, ulnar artery, all those fall into this category. Arterioles are the tiniest arteries, and they have smooth muscle surrounding the pipe or the tube. Arterioles can change their size very easy and very dramatically. So the arterioles are sort of the valves of the capillary beds. So when the arterioles get big, lots of blood flows through the capillary beds. When they get small, less blood flows through them. All right, capillaries we're going to talk about in a minute. Venules are the smallest veins. Capillaries, when they come back together, they form venules. Venules are boring. They're basically just a covering and an endothelial lining. They're just really a little bigger than a capillary. Medium-sized veins, their claim to fame is they have valves, which we're going to talk more about here in a minute. And then the large veins their claim to fame is they have very smooth walls and they provide a very low resistance pathway for blood to return to the heart. Because by the time blood has gone through arteries, here, arterioles, capillaries, and then back into the large veins, it's lost almost all of its pressure. So the veins have to be very easy to travel through, or there won't be enough pressure for the blood to make it back to the heart. So the large veins have very slippery walls on the inside, and they tend to be quite a bit bigger than the arteries that sit next to them in the body. And that's so that the bigger the pipe, the easier it is for stuff to travel through it. So we see that in the large veins. All right. Okay, so what about the capillaries then? Well, essentially, there are 3 types of capillaries. The continuous capillary, which is here, and you'll see that the walls are sort of smooth. The fenestrated capillary is just like the continuous one, only its walls have holes in them. And then the last type is the sinusoid, which we'll talk more about in a minute. So we've got 3 different types of capillaries found in different parts of the body. So the continuous capillary is the classic model. In other words, most of the capillaries in the body look like this, are continuous capillaries. So what are we looking at here? Well, a capillary is a tube, just like a vein or an artery, only its walls, the walls of the pipe are very, very, very thin. As thin as really you can make a thing in the body. And that's because the walls are made up of epithelial cells called endothelium, and they're of the squamous variety. So remember last year we talked about the different kinds of epithelium? Squamous epithelium are flat, and oftentimes they have kind of a hexagonal shape to them. They look a little bit like paving stones, that you might lay out on the grass to make a flat surface. Well, endothelial cells look a little bit like that. So here's one right here. Here's its nucleus. Here's its borders. And all together, they fit, the endothelial cells fit right up against each other so that they make this continuous tube on the inside. So in cross-section, here's a nucleus, here's one endothelial cell, and then here's its border. So where the endothelial cells come together, so like here's an endothelial cell and here's one, right? And here's the where they join together. If we zoom in and look at that, we see that the endothelial edges come very, very close together. And they even have this kind of wavy pattern that sort of interlocks. So the reason for all that is we want to have it be easy for stuff to get from in here, where the blood is, to out here, where the cells of the tissues are. But we want to be able to control what goes in and comes out. So in order to get from in here to out here, most substances are going to have to pass through an endothelial cell. That means that these endothelial cells can control what exits and what enters because those things are going to have to pass through them, right? So they've got control over what goes in and comes out. Now, this is technically an open hole, though. In other words, here between the endothelial cells, stuff can squeeze out, just not anything very big can squeeze out. All right, so that's the continuous capillary. In the fenestrated capillary, same model, endothelial cells that make the tube, endothelial cells that come very close together at their edges, right? The difference is these endothelial cells are popped full of holes, right? So it means that it's much, much easier for stuff, particularly fluid, to get from in here to out here. Because this looks like a colander, right? Water flows very easily through it. And that's sort of what these fenestrated capillaries evolved to do, is the same thing that a colander in the sink does. And that is to allow water or fluid to pass through, but block anything large from passing through, like a large protein or a red blood cell or a white blood cell. So fenestrated capillaries are only found in a couple of places. The one that we're going to talk about in a later chapter is we have these in the kidney, in the glomerulus, which is the first part of the nephron, and nephrons are what make the kidney work. So these are the most common. These are far less common, but have this unique feature of allowing stuff to pass more easily through. Did you have a question? Okay, corner of the eye. All right. The last type of capillary is found in only a few places, and this is called a sinusoid. The biggest difference is when you look at this doesn't look like a tube at all, right? And that's the biggest difference. The sinusoid, evolutionarily, this is a much older form of capillary. So it's less refined and it's less sort of perfected. So a sinusoid is sort of a loosely, it's not really a tube at all, but it has a structure that allows blood to pass through it, but not necessarily in straight lines, right? So we're going to see sinusoids in the liver. That's what we're actually going to talk about in this class. But you also find them in the spleen, the bone marrow, in certain endocrine glands, and then in the placenta. So one of the biggest features of the sinusoids is that the endothelial cells don't come right next to each other. Instead, they have gaps. So like, here's a gap right here, here's a gap right here. And these gaps can be large enough for like a red blood cell to escape. at those spots. And you might think that's a bad idea, but like in the liver is where old and dying red blood cells are destroyed, right? So they need to be able to get out so that the liver can take those cells apart and then recycle their contents. So that's one bit. They have gaps. Another is just like fenestrated capillaries, they have holes too. So the sinusoid is the easiest capillary to get into or out of. So we find them in places where that kind of exchange is necessary. All right, so the sinusoids. We don't talk very much about these, but we will see them get in the liver. All right. And so capillaries never exist all by themselves. They're always part of a system called a capillary bed. And what a capillary bed looks like is, so this region right here in the center, this is the capillary bed, particularly this spot. So feeding this complex network of capillaries, we're going to have an arteriole. So arterioles are the smallest arteries, right? And because they have all this smooth muscle wrapped around their walls, arterioles can get very, very small, or they can relax and get quite big. So when a tube gets smaller, it becomes harder and harder for stuff to pass through it, right? Think about, drinking through a normal straw and then trying to drink through one of those coffee stirrers. The coffee stirrer is much, much more difficult, right, to get fluid in. Same idea in the blood vessels. When a vessel gets very small, it gets harder and harder for stuff to pass through it. So it can act as a kind of valve. We don't have enough blood to have all of our capillary beds fully open all at once. If that happened, your blood pressure would drop and you'd be in cardiovascular collapse. And the reason for that is the body, is never trying to do everything it can do at once. So, for example, if you're exercising, the capillary beds in your digestive tract are pretty much shut down, whereas the capillary beds in your skeletal muscle are wide open to provide oxygen and nutrients. The opposite is true when you're sitting on the couch after a big meal. Your capillary beds to your digestive tract are wide open, but to your skeletal muscles they're quite small. So the body plays this trick all the time, and the way that it does that is by the arterioles. The arterioles can turn capillary flow up or down according to what the tissues need. And it's a fascinating regulatory mechanism that in a busy tissue, the signs of a busy tissue or the artifact of that actually causes arterioles to dilate. Here's what I mean. Like in skeletal muscle, when you're exercising, the CO2 levels in that tissue are going to go up, right? And the nutrient levels are going to go down. When those things happen, that triggers the arteriole to relax, allowing more blood into that tissue and supplying the oxygen that's needed and getting rid of the carbon dioxide and so on. So the arterioles and the capillary beds and the tissue that surrounds it. So what isn't in this picture is, all around in here would be, the cells of whatever tissue this was. So liver or skeletal muscle fibers here or cardiac fibers is what would be around in here where the blood is supplying those things. So there's a relationship there. The tissues tell the arteriole how much blood flow they need. The arteriole gets bigger or smaller to allow more or less blood through the capillary to supply those tissue needs, right? Okay, so arteriole, capillaries. The capillaries come back together to form venules. These are venules right here. And then eventually they're going to join up with a vein up here. So the venules join together to make a vein. Now, because our capillary beds aren't used all the time, there still has to be a way for blood to get from here over to here without passing through this. Because let's say this tissue is dormant, it's a resting skeletal muscle. There's no point in having the blood flow through the capillaries because the tissue doesn't need anything at the moment. So there's a bypass channel, which is right here, called an arteriovenous anastomosis. So when the capillary bed is shut down, the blood is going to flow through this bypass channel instead, so that it can still return to the heart and return to the lungs to get refreshed. So in the key here, you can see that there's areas of continuous blood flow like in the artery and vein here. And then there's areas of variable blood flow, which are spots that can be turned up or turned down by the arterial or what we call the precapillary sphincter. So a sphincter is just a muscle valve. When a sphincter contracts, the hole gets smaller. When the sphincter relaxes, the hole gets bigger. So the arteriole is sort of the master valve, and then these precapillary sphincters, there'd be one here and here too, are sort of the secondary valves, the fine-tuning, the fine control, so to speak. So capillary beds. We'll talk a little bit more about how stuff moves at the capillary beds in the next chapter. All right. Okay, so a unique feature, so capillaries make venules, venules make veins, veins head back to the heart. Medium-sized veins have this special feature, and that is they have valves on their inside. Arteries have no valves. Veins, medium-sized veins have valves. Large veins don't have valves. So why is that important? Well, it turns out that, by the time blood has made its way through the capillaries, it's lost almost all of its pressure from the heart. So the only way it's going to get back to the heart so that it can be circulated again is to use this very small amount of pressure that it has left to make that journey back to the heart. Now, for human beings, because we stand upright, that journey is made more difficult by gravity. Unlike an animal that's on all fours, that's never very far above the ground, for us humans, we've got to get blood from our feet all the way back up to the heart, which is 3 to 5 feet, right, to get blood back. So we have to have some tricks to getting blood back to the heart. And one of those tricks uses these valves that are found in veins. So what we're looking at here is what's called the skeletal muscle pump. And in order to understand it, you have to see that these valves are one-way valves. Okay. So if blood is flowing up in our picture up here, it's going to encounter these nice smooth surfaces, right, of these flaps. Well, smooth surfaces can be pushed on, right? So as blood flows up in our picture, these nice smooth bits here are pushed flat against the wall of the vein, right? So that blood can flow in this direction just fine. Well, what if blood tries to flow the wrong direction? So down in our picture here. Well, now the blood encounters, instead of nice flat surfaces, it encounters this kind of cup-like shape, right? So as blood tries to flow this way, these cups are filled, and literally the valve pushes itself closed, so that blood can flow up just fine, but down it can't flow at all. So it makes these simple little flaps one-way valves. In other words, it allows blood to flow in only one direction. Reverse flow is prevented because the little cusps are forced closed. We're going to see very similar, the heart actually has two valves that are very similar to the valves that are found in the vein, at the aorta and at the pulmonary trunk. So we're going to see this mechanism of closing the valve again. All right, so what does that mean when we put it in motion? Okay, so as we walk and stand, the muscles in our legs in particular contract and relax, right? Well, those muscles have veins that pass near them or through them. And as the muscle contracts, it changes size, right? So here, this is at rest. We've got the two closed valves. So this valve is closed and this valve is closed. The blood wants to go up the leg in this case. So as this muscle around this vein contracts, so this might be the gastrocnemius muscle, let's say, when it contracts, it squeezes the vein. You see how this area right here has been squished in our picture? Well, there's blood in there. So the blood is going to try to go somewhere. So when it's squished from the sides, it wants to go down and up. But it can't go down because the valve prevents it from going down, right? It keeps the blood here. So the only place that the blood can go is up. So as we walk and move, this mechanism essentially pumps blood towards the heart using skeletal muscle that's near veins. So, like if you've ever been on a long airplane trip and you get up and you're a little lightheaded, the reason for that is you've been sitting for so long that blood has had a tendency to pool in the lower areas of your body because this skeletal muscle pump has not been working. So you can sort of experience the effect of this thing in that kind of thing. Once you get up and you get moving, this system helps to return that blood back to the heart. That supports your blood pressure, which is why you got a little woozy in the first place.
Is that what they say like elevated?
Yes. Another trick is even as your seat, contract your calf muscles because that helps to get blood back to the heart too. On really long flights, it's best to just get up and walk a little if you can. All right, so veins and valves. So you can see valves. One of the spots you can see them is in the veins in the wrists because it's just a thing to sort of play with when you're bored. If you sort of try to push the blood up your arm, you don't see any interesting effects. But if you try to push the blood in your veins back down towards your hands, you'll see little spots where the blood won't sort of stops flowing towards your hands, and that's a spot where there's a valve. So you also encounter valves when you go to put an IV in or draw blood, because if you're unlucky enough to have put your needle in right where there's a valve, it can sort of flap and close off your needle. So it sometimes means you have to pull back and pick another spot. Because these valves are found, every 3 or 4 inches in most big veins. All right. Okay, so the distribution of blood in the cardiovascular system is not uniform. You might think that, that 50% of the blood would be in the veins, 50% in the arteries, and maybe a little in the heart. But it isn't like that. So if we look at all the blood in the body and where it is at any given time, we see that about 7% of the blood is actually in the heart, 9% is in the pulmonary circuit, so this is blood going to the lungs and back, or in the lungs. About 13% is in the arterial system, 7% in the systemic capillaries, but then, boom, 64% of all the blood in the body is in the systemic venous system. Please don't feel like you have to memorize these numbers. The numbers are not memorizing worthy, all right? But the idea that most of the blood in the body is found in the systemic veins, that's the take-home message. So why does that matter? Because it gives us a kind of blood storage. Yes, blood is circulating all the time. There isn't a spot in the body where it's sort of sequestered or stored up like you would store up water for a dry day. But because most of the blood is in the venous system, the body can do this neat trick called venoconstriction. So veins, they have smooth muscle in their walls too, but it's used for something different. In arteries, the smooth muscle is used to either constrict or dilate a vessel to either increase or decrease the amount of blood flowing through it. For veins, the reason they constrict is not to reduce blood flow, but to just reduce their size. So in our diagram here, we've got, it looks like this, right? So this is veins, and this is the rest, right? Well, when veins constrict, they can shift this pie chart. So if all the veins in the body constrict, we might get this instead. So we may go from 64% to 50-50. Now, why does that matter? It means that we've just increased the amount of blood circulating through the arterial system and the heart and the capillaries by 14%. So when you, like right now, because you guys are at rest, this is sort of what your pie chart looks like. If you were to get up and start exercising, what you would see is that the systemic venous part would get smaller as more blood enters your capillaries and arterial system to supply your muscular activity. So this idea of the blood reservoir is an important one because it means not only in exercise, but if you have a massive blood loss, the same thing can happen. The system can continue on because the veins can get smaller. So the reason that veins get smaller is not to restrict blood flow, it's to reduce the total amount of blood in the veins in the system. So we call that venoconstriction, right? I think that's... Okay, so this question is actually from last time, but the layer of the arterial wall that can produce vasoconstriction is, which are those? There, everybody's logged in. All right, jump in there with your answer. All right, good. We got a 6-3 split between B and C. Correct answer there is B. Tunica media, M for media, M for muscle. Muscle is what makes the artery get bigger or smaller. So it's the tunica media that gives us the capability of vasoconstriction. All right. Blood flow through a capillary is controlled by which of those? All right, last two people jump in there. All right, we have a good teaching point. All right, so the one answer that isn't up there would be arteriole, right? Arterioles control blood flow through the capillary, but the precapillary sphincter also controls blood flow through the capillary. The arteriole is like the master valve, and the precapillary sphincters are the fine tuners. At the entrance of each capillary tube is one of these sphincters. Venial is where the blood goes on the other side. So capillaries come back together and form venules, which are essentially little tiny veins. All right. All right, we're going to skip that one. All right, so the balance of this chapter is the named arteries and the arterial anatomy, right? So some general patterns that you'll see is the left and right sides are mostly identical. Now, where that starts to depart is when you get very close to the heart. The first few arteries and first few veins are not symmetric. But once you get out to like the arms and legs and the abdomen, if there's one on the left, there's going to be one on the right too. All right. That's one. Another pattern is a vessel is sort of like a road. You know, you can get on the road at one place and you can take it, very far away. So a single vessel its name is going to change as it goes from the heart out to the body. So just like a road, if you're on an interstate and the interstate divides, well, chances are that the divisions are going to have different names than the original, right? So we see that in the body, that the names change as we cross from one anatomical region to the next. All right. And then tissues and organs usually have more than one arterial artery and more than one vein. The reason for this is for robustness. If a kidney, for example, had only one artery that supplied it, if that artery had a clot, you'd lose that whole kidney, right? So there are some spots where it's just one artery, but for the most part, there are multiple arteries that supply a given organ. All right. So this is just sort of the concept diagram of the cardiovascular system. So here's the heart, right? Here's the lungs. So I've put a box around the pulmonary circuit that goes from the heart to the lungs and back again. Everything outside of that box is part of the systemic circuit. So that means systemic just means the rest of the body. The body besides the lungs. So we have, blood is going up here to the brain, to the upper limbs, to the kidneys and other organs in the abdomen, the digestive tract, the gonads, and of course the lower extremity of the legs. So that's sort of the overall diagram. All right, so first up is the pulmonary circuit. This is the heart in the middle. Here's the lungs, right? My note here is we should know all of the labeled structures here. Why? These are all what we would call the great vessels. In other words, the vessels going into and coming out of the heart, of course they have clinical significance. They carry all of the blood supply, right? So, one of the reasons why being shot in the center of the chest is particularly bad for you is because of these major vessels that surround the heart. So even if your heart is missed, if you get shot through the superior vena cava, you're probably going to be dead before you get to the emergency room anyway. What are those vessels? The inferior vena cava brings blood from the lower half of the body. The superior vena cava drains blood from the upper half of the body. Both of those enter into the right atrium here. The right atrium goes to the right ventricle. Right ventricle goes out to the lungs. That's called the pulmonary trunk right here. The pulmonary trunk divides into a left and right pulmonary artery. So here's the left pulmonary artery. Here's the right pulmonary artery. When blood comes back from the lungs, it comes back through the pulmonary veins. So here's a left pulmonary vein. Here's a right pulmonary vein. In the lungs, this is the only place in the body where arteries are blue and veins are red. And the reason for that, and of course in real life they're neither, right? That's where when we look at, there's no shiny blue and shiny red in the living human being. But the reason we color them this way, it has to do with whether they have oxygen or not. So red is oxygenated, blue is deoxygenated. So blood goes to the lungs without oxygen, and it comes back from the lungs with oxygen. So it's the only place in the body that we see arteries colored blue and veins colored red, so don't let that confuse you. All right, so pulmonary veins here are going to return to the heart, and then back to the left atrium, then the left atrium to the left ventricle, and then the left ventricle goes up and out and into the aorta. So here's the aorta. Okay? So all of these vessels are worth you knowing. You can sort of put an X through this zoom-in box here because we're going to talk about that in the respiratory chapter. But I do want you to know the vessel names. Yeah.
As far as the chart goes,
You're using different vocabulary than the chart, like the, I don't know what you said, I'm sorry.
Which chart?
The one that's on the screen right now.
Oh,
I'm just saying, because we have left ventricular, that where is that in comparison to?
oh, that isn't labeled. I'm just telling you that that's where it's coming.
Just know what's on
The ventricles and atrium, those are in the heart, and we're going to get to those in the next chapter.
Okay.
What's labeled on this are the vessels. So the superior vena cava, inferior vena cava, the pulmonary trunk here, pulmonary arteries left and right, pulmonary veins left and right. Does that make sense?
It does. The ascending aorta
Yep.
and the aortic arch.
Ascending aorta is here. That comes, yep. And
That's the
then
bottom part.
here's the arch, because it's going to go up, around, and then it's going to go back down. and descending aorta is going to go down into the abdomen. You'll see a better picture of the aorta than the label.
Okay, is it, so the ascending aorta is on the bottom part of that kind of?
The ascending aorta is from the heart, here's the heart, right?
Mhm.
Heart up to arch. So it goes ascending aorta, aortic arch, and then all of this is descending aorta.
Okay.
Good question.
I'm just trying to differentiate between the two because they're both in the same.
Because this is a picture out of your book in this chapter, right?
Yeah.
Just checking to see if I didn't do something strange. Okay, so this is your vessel study guide. And the reason for that is this does not include all of the named arteries and veins, right? This is sort of these are the big ones. So I can't ask you anything off of this slide. So, just like we were talking about, what we see is that we have arteries. The arteries are the same on the left and right. So like you have a brachial artery here, and you have a brachial artery here. You have a radial artery here, and a radial artery here. So they have not labeled all of the vessels on both sides so that they can, so that it's not as clumsy. Another thing you'll see is that, except in the arms and legs, where there's an artery, there's a vein that goes there too. So arteries and veins sort of match. They do in the arms and legs too, but there's always an extra set of veins in the arms and legs compared to the arteries. So like here, we have the cephalic and the basilic vein, but we don't have anything like that on this side. The reason for that is in the arms and legs, there's a superficial venous path. In other words, a path for blood to return to the heart going just underneath the skin. And then there's a deep return path. And the reason for that is it helps us to control our heat loss. So like when it's very cold outside, blood doesn't really pass through the cephalic and basilic veins. Instead, it comes along through the brachial vein instead. But many of these arteries you'll hear talked about in, when we're talking about the blood flow to certain regions. So they're worth knowing. All right? But I also don't think that it's worthwhile for me to go through and read each one to you, because I don't think that doesn't really help at all. So there'll be a question or two of just plain anatomy of the vessels. All right? Let's see. Some of the harder ones. Okay, so the vertebral artery goes up the back to the brain. The common carotid, which is right here, supplies the head and neck as well as the brain. The subclavian artery is one of the branches of the aortic arch, so it's one of the larger vessels in the body. Here's the ascending aorta, aortic arch, descending aorta. The descending aorta splits into the two common iliac arteries. Those common iliacs then split again down here in the leg, so that we get the femoral artery and the deep femoral artery. When we get down into the legs, just like the arm, we have a fibular artery and two tibial arteries. So oftentimes in the extremities, the arteries are named for the bones they're next to, right? So radial arteries on the radial side, ulnar artery follows the ulna down. In the abdomen, of course, we've got the renal arteries going to the kidneys. The celiac trunk is what supplies the digestive tract, and we'll hear more about the celiac trunk when we get to that chapter. But, all right. Your book does a pretty good job of sort of zooming in on the different regions because, let's face it, a diagram like this it's hard to see. The only reason I really have this in here is because this is your list. These are the arteries I want you to know, but you're going to see them better in the other pictures in your book, right? So the aortic arch has three main branches that come off of it. The brachiocephalic trunk is right here. It supplies the right side of the head and the right arm. So brachium is this part, is the upper arm, right? cephalus is the head. So this is the trunk that goes to the arm and head, which is exactly its distribution. On the left side, we have the common carotid that comes up, and it's going to supply the head on the left. And then the subclavian artery is going to go over and supply the arm. It's going to become the axillary artery, which is here. And then the brachial artery. The brachial artery then splits, and we have a radial and ulnar artery. There are veins that go along with those. So there's a radial vein and ulnar vein. But then we have those superficial veins too. And in your book, they're colored with a lighter blue so that you can sort of tell the difference. The dark blue veins are found down deep. They're usually right next to the arteries. The superficial veins, they take a different path back to the heart. So one you might want to underline this one. The median antecubital vein is the vein that is most often used to take blood from somebody or to put a large bore IV in. So, you know, we've all had blood taken from our elbow, right? Well, the vein that they took it from is the median cubital vein or the median antebrachial vein. But the median cubital vein is the most common one. Into the head and neck. So in terms of arterial supply to the brain, there's one from the front and there's one from the back. The one from the front is the carotid artery, which is right here. The one from the back is the vertebral artery. So if you remember when we looked at cervical vertebrae last semester, they had little holes in them, little round holes. Well, it's the vertebral artery that's passing through those little round holes and on up into the brain. And when we get to the brain, the vertebral circulation from the back and the carotid circulation from the front are actually connected together in what we call the circle of Willis, which I'll show you here in a minute. All right. Let's see. The brain is a little different. It doesn't have veins, per se. Instead, it's drained by what are called sinuses. And a sinus is really just a big vein that is held open by bone and other tissues. So, like another way to think of the brain is it's supplied from the center, so the arteries go into the middle of the brain, but the veins come out of the edges, out of the outside. So we have the dural sinuses here draining the brain, and then eventually those all emerge through the jugular vein, so the jugular foramen into the jugular vein, and then down into the subclavian vein. All right. The cerebrum of the brain has an anterior circulation, a middle circulation, and then a posterior circulation. And then the cerebellum has its own circulation as well. So what we see is here's the carotid coming up, and here are the vertebral arteries coming up. So there's a front circulation and there's a back circulation, and the two are connected in this region called the cerebral arterial circle, or the circle of Willis. All right, so here are two carotid arteries coming up, right? Here are the vertebral arteries coming up from the back. They join together to form the basilar artery here. It's sort of a weird structure because we have a left and a right that join together to make a central, which doesn't happen in the body very often. The basilar artery then divides and creates the posterior cerebral artery to go to the occipital lobe. The carotid artery comes up from the front then, and it divides to make the middle cerebral and anterior cerebral artery, but the two are connected. So you can see here and here, those are called the posterior communicating arteries. And they connect the carotid circulation in the front with the vertebral circulation in the back. So it means that you can have a big giant clot right here, let's say, and not suffer any consequences because the blood can come from a different direction. These are called anastomosis. And anastomosis is where an artery connects to an artery, right? So we have this one, the posterior communicating arteries here, And then the other connection is in the front. So between the two anterior cerebral arteries, here and here, there's a tiny little connection called the anterior communicating artery. And it's important because it connects the left and right side of the circulation. So let's say you had a big giant clot here. Well, blood can come from the other side, cross through this anterior communicating, and still supply the brain. So the circle of Willis, or the cerebral anterior circle, is it's a redundancy. In other words, it makes our brain and its blood supply much safer, because it means that instead of having just one artery doing the job, we have all of these connected arteries, so if one fails, another one can take over. So it evolved because, obviously we need brains to survive, right? So it needs to have a sort of backup blood supply. So that's the easiest way to think of it, is as a backup. Sorry. The dural sinuses, that's what drains the veins. So this is what brings blood to the brain. This is what drains blood away from the edges. All right. So branches of the descending aorta. In all of these, so in these regional pictures, they may include some arteries that are not in that master diagram. That master diagram of the whole body, those are the ones I'm holding you responsible for, not all of these. Okay, does that make sense? So you may want to go through with a highlighter and highlight the arteries on these regional diagrams that are also on the other one. All right, we've got to stop there because we're out of time. All right, so I will see you all